What is going on here? I think I have a legitimate reason to ask a question. Do y'all see these field hospitals that popped up in Jamaica? Field hospitals. Okay. Are you for them or are you against them, or do you not understand what it's all about? That's a question. Are you for them or are you against them? I need you to answer in the comment section and tell me why. Or are you one of the people like myself that does not have a full understanding of what it's about? Anyway, shout out to the Observer for the one here. Dr. Tufton calls for an end to COVID conspiracies. Him says stop it. And you can go read this article yourself by Horace Hines. And he is an Observer staff reporter. And the article was printed Saturday, September 26th of 2020. Fresh. New thing. So, Falmouth Trelawney, Minister of Health and Wellness Dr. Christopher Tufton had dismissed what he called the reckless circulation of COVID-19 conspiracies in the public domain, which, he said, only serves to compromise government's response to the virus, which is now in the community transmission phase. All right, so check it out. Before I go any further reading this article, let me say this. We have legitimate concerns. I did a live video recently. We're not trying to scare anybody. We're asking valid questions that I think need to be answered out loud by those who are in charge. That's all. Don't tell us to not ask questions. And if you stay silent with the truth and you let conspiracy theories spread, then you are a part of the problem. If you have the truth, put it out there. People are going to talk what they want to talk regardless, but at least they will be able to find what you have said pretty easily so they can counteract what they are hearing. We live in an informational age, and unfortunately, plus fortunately, the internet is here for fools as well as it's here for intelligent people. So everyone has a platform now to say what they feel, say what they think, say what they've heard, so on and so forth. It is up to us to use an intelligent mind and approach things in that kind of a manner and sift the sense out of the nonsense. Anyhow, you have the COVID conspiracy around election. This is Dr. Tufton talking. He says you have the COVID conspiracy around the election and when it was called, and whether you announced information before or after. You have the COVID conspiracy around vaccination and whether you in league with Bill Gates in order to push vaccination on black people. You have the COVID conspiracy around drug trials, with things being circulated about whether we are doing this in the interest of the people or we're doing it in the interest of the industry. There are too many COVID conspiracies that are dominating, unfortunately, mainstream conversations, which, frankly speaking, does nothing for the COVID response but to undermine the strategic thinking and the collaborative effort that is necessary to advance an effective and efficient strategy to overcome this global threat and this threat to the Jamaican people. These were, quote unquote, Dr. Tufton's words, taken directly from the Observer. We are very sincere about what we are doing, Dr. Tufton said. And so far, as a country, we have done well in containing the spread of the disease. Thus, we mustn't beat up ourselves. And like I've said before, for Jamaica to be like roughly 90 miles off the coast of Florida, Florida is overran by this thing. And our borders are open and people are going in between Jamaica and Florida and so on and so forth and other places that have this thing in abundance and all this. And I know that our numbers have jumped significantly within a 1 month space. We went from like 1,000 and something to over 5,000, right? And this was following the election. So people have legitimate questions. All right. And he added that there are many persons who have had much greater difficulties, some with far more resources than us, and never got it right until late in the day. I commend the public health team I recognize the contribution of persons who have spent 15, 18-hour days, 24 hours a day, around the clock, on standby, responding and developing an approach to dealing with this public health threat for the last 7 to 8 months, long before the first case came to Jamaica. Many are tired, many are burnt out, but they stick to the wheels and do it as their obligation to the health and wellness of the Jamaican people. We cannot allow COVID conspiracies or COVID conspiracy theories to undermine the effort of the COVID response, he said. I implore Jamaicans who are doubtful over their government's modus operandus in dealing with measures to contain the virus to seek audience with the Ministry of Health and Wellness for clarification. Now, again, I said I have a few questions. And if you watch my morning thoughts on this, where I said that the Prime Minister said there will be the vaccination available once it is developed, once it is safe, tested, and safe, it will be available for free to all Jamaicans. And I had some questions about that. Questions along the lines of who developed this vaccine? How was it tested? What is the long-term side effects, outlook, proven, etc., etc.? Clearly, there probably won't be any long-term data right now because it was freshly developed in a hurry and distributed to people without knowing the long-term side effects. So how are we going to study the long-term side effects but through the people who are going to get it? These are legitimate questions. You understand? So people are in a time where everyone is paranoid. Nobody wants to catch this thing. And everyone wants to know where is it coming from when it's time to get stick with a needle and put something into their body. He said that we should hold audience or seek audience with the Ministry of Health and Wellness for clarification. Okay, we are seeking audience with the Ministry of Health and Wellness to answer these particular questions. We have never been hesitant to sit down and have a conversation, he said. Don't write or talk things that promote panic, because panic is the enemy of the response to the COVID fight that we are taking on, he said. Dr. Tufton was speaking yesterday at Falmouth Public Hospital during the contract signing between the Ministry of Health and Wellness and Rogers Land Development Limited for the establishment of 2 COVID field hospitals. One of the facilities will be constructed at the Falmouth Public General Hospital and the other at the St. Joseph's in Kingston. The 2 field hospitals will be constructed at a combined cost of $199 million and are expected to be completed between 6 to 8 weeks from now. Both facilities will boast 36 beds apiece. Now, you know, honestly speaking, I look at this at another angle. I know what the field hospitals are. Okay, it's a hospital that's set up out in the field, and we normally use this in the military, like when we're on deployments or when we go out to field training exercises. This is where all your first aid, it's basically just tents, but a certain kind of tent that is built specifically to house those who are ill, those who are sick or whatever, and you can conduct your medical affairs from there. Now, given the state of most of our public hospitals in Jamaica, I'm just saying this is a clean alternative. That's just my take on the field hospitals. Now, Dr. Tufton noted that the field hospitals and another one in the National Chest Hospital, a gift from the U.S. government. These are gifts from the U.S. government. And a mobile field hospital that is being worked on will provide a total of 150 additional beds to the 350 existing COVID beds in hospitals across the country. If we're having numbers rising so much at such a rapid rate, remember I just said that a month ago we were at 1,000 and change, and now we are at 5,000 and change in a space of a month. Those numbers are to be questioned, right? Okay, we are going to need clean areas to help those who are in need. And if the hospitals are overrun with only 350 existing beds across the entire island in a population of over 2.5 million people, then it only makes sense to create another way. And I see these field hospitals as another way. The minister, meanwhile, warned that more beds would be needed if people continue to act like them don't see the COVID-19 protocols. Go to a road with no mask on, laugh and talk and sneeze pan people and have them sneeze pan you. I gather up at parties where on a share on a spliff and do all these kind of things and up in each other's face, breathing in and exhaling, inhaling, same exchange of air and these things. No social distancing and all these things. The numbers are going to continue to rise. If we don't follow the rules, then it would likely mean that we are going to need a lot more than 500 beds, because persons would have acted contrary to the deliberate plan that we have in order to manage and control the spread of the virus. Everything is not in the control of the government. It is a collaborated effort that involves all of us, and we must work together, Dr. Tufton has stated. So in this video, you just found out what exactly the tents are for, the field hospitals are for. You just found out exactly where they will be located, and you just found out exactly who gave them to Jamaica, and you also found out exactly how many people or how many beds will be in there and how many people it will be able to accommodate. All that information in this one video. Talk up in the comment section. Do you have questions about new vaccine when vaccine is developed? Do you have questions, any more questions after this about the field hospitals or anything else that has to do with this whole situation? How did we go from 1,400 and something to over 5,000 and change in the space of 1 month, etc., etc.? Leave your comment and make we talk. It's SouFLoTV. I'm out. Peace.